Hi, my name is Dadriel Bailey, and in this presentation, we will discuss metabolic acidosis and compensations. Let's begin this presentation by defining metabolic acidosis. Metabolic acidosis is a condition caused by a chemical imbalance between the acid and base within the blood. This can occur if the body is making too much acid, is not getting rid of enough acid, or is not producing enough base to balance the normal amount of acid. An imbalance of chemicals within the body will lead to the body's inability to properly process. Metabolic acidosis can range from mild to life-threatening. Now that we have defined metabolic acidosis, let's discuss the causes of this condition. There are several factors that may trigger a chemical imbalance within the body, leading to metabolic acidosis. Metabolic acidosis may appear in many forms. Ketoacidosis occurs when the body is unable to produce enough insulin and becomes dehydrated. When this occurs, the body will begin to burn fat as fuel and make ketones. When ketones build up in the blood, it will turn acidic. This may occur in individuals that are diabetic or those who consume a lot of alcohol or are not eating at all. Lactic acidosis occurs when lactic acid builds up in the body because of a lack of oxygen for the cells to use. This form of metabolic acidosis can occur due to intense exercising, dramatic drops in blood pressure, heart failure, cardiac arrest, or an intense infection. Renal tubular acidosis is a condition that occurs when kidney diseases, immune system disorders, or genetic disorders damage the kidneys. Because of this, the body is unable to properly remove acids from the blood. When acid is not removed through urine, it will build up within the blood. Hyperchloremic acidosis occurs when issues such as severe diarrhea, laxative abuse, or kidney problems lower bicarbonate levels. Bicarbonate is a base that neutralizes acids in the blood. Individuals with metabolic acidosis may exhibit various symptoms. These symptoms may include fast breathing, fast heart rate, headache, confusion, weakness, lack of appetite, queasiness, or vomiting. Ketoacidosis may exhibit the symptom of fruity smelling breath. If you begin to experience these symptoms, tests can be performed in order to properly diagnose the condition. The following tests may be performed in order to diagnose one with metabolic acidosis. An anion gap is performed in order to measure the chemical balance of the blood. This test compares sodium, chloride, and bicarbonate. The pH of the blood and oxygen and carbon dioxide levels are all measured in the test that uses arterial blood gases. Urine tests are used to identify ketoacidosis, kidney issues, ketones, or poisoning from alcohol, which are all causes of metabolic acidosis. Now that we have a better understanding of metabolic acidosis, let's discuss its compensation. Hyperventilation is compensation for metabolic acidosis to decrease the arterial partial pressure of carbon dioxide. The respiratory center is stimulated when peripheral and central chemoreceptors detect metabolic acidosis. It takes between 12 to 24 hours before maximal compensation is reached. The formula used in order to calculate the expected partial pressure of carbon dioxide at maximal concentration is expected partial pressure of carbon dioxide equals 1.5 times actual bicarbonate plus 8 times millimeter of mercury. The limiting value of compensation for metabolic acidosis typically falls between 8 to 10 millimeters of mercury. This value is the lowest level at which partial pressure of carbon dioxide can fall. Disorder of the acid base disturbs the homeostasis of hydrogen ion concentration in the plasma. There was research conducted that provided a better understanding of the acid-base disorders. It is imperative that you get an understanding of the pathophysiology, diagnosis, and treatment and monitoring process in order to properly evaluate lab results of the patients affected by this disorder. The body strives to maintain controlled limits of acid base. In order to gain an understanding of the acid-base disorders, you must understand the bicarbonate system of the extracellular fluid. This system is composed of a weak acid and conjugate base. The job of the bicarbonate system is to resist the changes of excess hydrogen ions. The concentration of hydrogen ions is regulated by altering the ratio of carbon dioxide to bicarbonate. Partial pressure of carbon dioxide levels are controlled by ventilation, and kidneys regulate bicarbonate levels. Acid-base disorders can be classified as either acidosis or alkalosis. Metabolic acidosis is caused by excessive hydrogen ion formation, reduced hydrogen ion excretion, and excessive bicarbonate loss. Partial pressure of carbon dioxide, total bicarbonate, total carbon dioxide, standard bicarbonate, and base excess are all important terminologies needed to properly understand these disorders. An ion gap refers to the measure of the difference between the negatively and positively charged electrolytes. When there are increases in the anion gap, disorders such as renal failure, ketoacidosis, lactic acidosis will develop, which are all causes of metabolic acidosis. When the concentration of bicarbonate is reduced, it is an important quality of metabolic acidosis. A reduction in the bicarbonate concentration means that the body's main buffer has used up buffering acid production in lactic acidosis or ketoacidosis. This research shows that assessment for acid-base disorder includes history, performing physical examination, interpretation of chemical tests, and arterial blood gas analysis. Important characteristics of metabolic acidosis also include investigation of lactose, glucose, ketones, and toxicology testing. This research concluded that it is very important to properly analyze all of these details in order to properly diagnose disorders of acid base such as metabolic acidosis. In order to properly manage metabolic acidosis, the underlying condition must be properly treated. With supportive management, the body is able to properly correct acid-base disorders. The ECLS approach is important for managing metabolic acidosis. Emergency management is imperative for life-threatening conditions for example, intubation for airway. Cause: the treatment of underlying disorders is important for therapeutic goals. Replacement of laws, such as fluids or electrolytes, are important and even recommended for treatment and management. Specific problems or complications are associated with specific causes or cases which require specific management. Accurate diagnosis is essential for proper treatment and results in the correction of metabolic acidosis. In order to properly treat metabolic acidosis, you must first treat the cause. Improper treatment may affect the bones, muscles, and kidneys. Common treatment of this condition include detoxification, insulin, IV fluids, or sodium bicarbonate. If the cases of metabolic acidosis become severe, it can lead to shock or even death. Prevention of this condition includes taking measures such as drinking plenty of water, eliminating alcohol, management of diabetes, and following directions of medications. In this presentation, we defined metabolic acidosis, described the factors that may trigger a chemical imbalance leading to metabolic acidosis, talked about the symptoms an individual with this disorder may exhibit, discussed tests that can be performed in order to properly diagnose one with this condition, discussed its compensation, discussed research based on metabolic acidosis, discussed proper management of this disorder, ways to treat it, and ways to prevent it.